The Complete Depression Recovery Guide. Everything you need to know. Opening. Welcome to the Complete Depression Deep Dive. If you've watched our main depression breakthrough video, you're ready for comprehensive information covering every aspect of depression, from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting wellness and hope. Progression and health impact. Without treatment, depression typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be mild mood changes and decreased energy, but they often expand to affect cognitive function, physical health, and social relationships over time. The condition can evolve from occasional low moods to persistent major depressive episodes that permeate work performance, relationships, and basic self-care activities. The physical health impact extends far beyond emotional symptoms, as depression triggers chronic inflammation and stress hormone activation. This prolonged physiological activation can contribute to cardiovascular disease, diabetes, obesity, and compromised immune function. Depression increases the risk for heart disease by 64%, as well as the risk of stroke, autoimmune disorders, and premature death, making early intervention crucial for preventing these serious complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing treatment-resistant depression responds well to newer therapies, and the brain's neuroplasticity allows for significant improvement, regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal brain function and well-being within 3-6 months of beginning appropriate care. Underlying causes and risk factors. Depression results from a complex interplay of genetic, biological, environmental, and psychological factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history increasing risk by 2-3 times. But having depressed relatives does not guarantee developing the condition. Neurotransmitter system differences, particularly involving serotonin, dopamine, and norepinephrine pathways, contribute to increased depression vulnerability. Environmental factors include childhood trauma, chronic stress, major life changes, medical illnesses, and certain medications. People who have experienced abuse, neglect, or significant losses are more likely to develop depression. However, many people with these risk factors never develop depression, while others with fewer risk factors do, emphasizing the individual nature of the condition. Psychological factors encompass negative thinking patterns, perfectionism, low self-esteem, and chronic worry. Physical health conditions, hormonal changes, seasonal light exposure changes, and substance use can also trigger or worsen depression symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that depression is a legitimate medical condition requiring professional treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, medical history, and functional impairment in daily life. Mental health professionals use standardized diagnostic criteria from the DSM-5 and assessment tools, like the PHQ-9 or Beck Depression Inventory, to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed interviews about symptom patterns, duration, and impact on work, relationships, and daily functioning. Physical examinations and sometimes laboratory tests help rule out medical conditions that can mimic depression symptoms, such as thyroid disorders, vitamin deficiencies, or medication side effects. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment. The diagnostic process also identifies any co-occurring conditions like anxiety disorders, PTSD, or substance use disorders, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of depression presentations and focus on functional impairment rather than symptom severity alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful recovery. Key questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress. Inquire about combination treatments, such as medication plus therapy, and whether newer treatments like ketamine or TMS might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient relief after 6-8 weeks. Ask about lifestyle modifications that can enhance treatment effectiveness, including exercise, sleep hygiene, and stress management techniques. Understanding the provider's experience with your specific type of depression and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access crisis support between appointments, and involving family members or support persons in treatment. Ask about long-term prognosis, strategies for preventing relapse, and transitioning from active treatment to maintenance care. Inquire about genetic testing for medication selection and whether your depression might benefit from specialized treatments. Medications and their effects. Modern depression. Medications offer effective symptom relief with improved safety profiles compared to earlier treatments. SSRIs like sertraline, escitalopram, and fluoxetine remain first-line treatments, typically requiring 4-6 weeks for full effectiveness while producing fewer side effects than older tricyclic antidepressants. These medications work by increasing serotonin availability in brain synapses to improve mood regulation and emotional processing. Newer medications show promise for treatment-resistant cases. Ketamine nasal spray induces rapid antidepressant effects within hours and is FDA approved for severe depression, avoiding the delayed onset that previously deterred many patients from medical treatment. Bupropion may be prescribed for energy and motivation issues while SSRIs take effect, though it requires careful monitoring to prevent anxiety or sleep disturbances. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different classes to find optimal results. Most people experience substantial improvement within 6-8 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and temporary, including initial nausea, headaches, or sleep changes that resolve as the body adjusts to treatment. Holistic and complementary approaches, integrative treatment approaches combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for depression recovery. Recent studies prove that regular aerobic exercise can reduce depression symptoms by 30-40% through endorphin release, neuroplasticity enhancement, and inflammation reduction. Regular cardiovascular exercise, particularly outdoor activities, produces powerful mood-stabilizing effects by increasing BDNF and promoting neurogenesis. Mindfulness-based interventions provide practical tools for managing negative thought patterns while building long-term emotional resilience. Cognitive behavioral therapy combined with mindfulness shows significant benefits for preventing relapse, particularly when combined with medication management. Nutritional modifications, including omega-3 fatty acids, vitamin D supplementation, and anti-inflammatory diets, support overall brain health and may enhance treatment effectiveness. Community support approaches have proven incredibly effective in providing social connection and accountability that people with depression often desperately need. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for depression management when used alongside professional treatment. Omega-3 fatty acids help reduce inflammation and support neurotransmitter function, particularly beneficial for people experiencing cognitive symptoms or treatment resistance. St. John's wort and same show promise for mild to moderate depression through serotonin system support. Vitamin D supplementation shows promise for seasonal depression and deficiency-related mood symptoms through direct neurotransmitter pathway support. Research suggests that magnesium and B-complex vitamins play direct roles in mood regulation and energy production, supporting the use of targeted nutritional interventions. L-theanine and ashwagandha have stress-reducing effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Light therapy boxes can provide immediate mood benefits during seasonal depression episodes or for people with disrupted circadian rhythms. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions for moderate to severe depression. Self-help strategies. Empowering self-help strategies provide immediate tools for managing depression while building long-term resilience and recovery skills. Behavioral activation techniques quickly improve mood and energy by scheduling pleasant activities and gradually increasing daily structure. Cognitive restructuring helps identify and challenge negative thought patterns that often accompany depressive episodes. Cognitive behavioral techniques include thought records, behavioral experiments, and problem-solving strategies that bring measurable relief. Creating structured daily routines provides stability and predictability that reduces anxiety and improves sleep quality. Regular sleep hygiene, consistent meal times, and scheduled social contact support overall emotional regulation. Gradual exposure to avoided activities help overcome social withdrawal and activity restriction that maintain depression. Keeping mood and activity journals helps identify triggers and successful coping strategies. Building social connections and maintaining meaningful activities prevent isolation and provide natural mood-boosting experiences. These strategies complement professional treatment and provide sustainable tools for long-term depression management. Supporting loved ones. Supporting someone with depression requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently increase guilt or shame. Listen without judgment and avoid minimizing statements like, "just think positive" or "snap out of it," as this invalidates their experience and can increase hopelessness. Instead, acknowledge their struggle and ask how you can best provide support during difficult moments. Learn about their specific triggers and symptoms and respect their need for accommodations while encouraging gradual progress rather than demanding immediate improvement. Offer practical support, like help with household tasks, transportation to appointments, or simply spending time together without pressure to cheer up. Encourage professional treatment while avoiding becoming their primary therapist or trying to fix their depression yourself. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and resentment. Support groups for family members and friends of people with depression provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery is often gradual with ups and downs rather than linear improvement. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce depression risk and prevent symptom recurrence in people with previous episodes. Regular exercise, stress management, and maintaining social connections create a foundation for emotional stability and mental health resilience. Developing healthy coping skills early helps people navigate life stressors without developing maladaptive patterns. Maintaining work-life balance, setting realistic expectations, and practicing self-compassion provides natural buffers against perfectionism and chronic stress that can trigger depression. Learning to identify and address negative thinking patterns before they become entrenched prevents the development of cognitive distortions that maintain depressive episodes. Regular mental health check-ins and maintaining therapy relationships help prevent symptom escalation. Early intervention during adolescence and young adulthood, when depression often begins, can prevent progression to more severe or chronic conditions. Education about depression helps people recognize early warning signs and seek help promptly. Building emotional intelligence, communication skills, and stress tolerance enhances protective factors and reduces vulnerability to triggers. These prevention strategies benefit everyone, regardless of depression history, by promoting overall wellness and resilience. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,